So welcome everyone. You are at the CTS webinar for the CTS Council on Transportation Planning and the Economy. So welcome to joining us today. I'm Lisa Austin with MnDOT, and I am the vice chair of the committee. I work with Minnesota Department of Transportation and the Center for Community Connections. Our chair, Mary Carlson, will be joining us a little bit later, and she'll help lead the Q&A at the end of the presentation. She's with Isthmus Engineering, and she's a CTS transportation, or she's a transportation planner and engineer with Isthmus. So today's presentation is titled the Health and Transportation Nexus, a unified model integrating multiple mechanisms for collaborative planning. The presentation will be presented by Nissa Tupper, who's with MnDOT as a transportation and public health planner, and Yingling Fan, who's a professor of regional planning and policy at the University of Minnesota Humphrey School. But before we get started on the presentation, I would take care of a couple of housekeeping things. I think everybody's pretty familiar with virtual platforms. In this case, we've got a Q&A tab for questions, and that's a nice way of kind of tracking questions you have during the presentation. And then when we have the Q&A at the end, we can kind of track whether we've answered those. If you do have a clarifying question during the presentation, you can certainly put something in the chat. And then when we do get to the Q&A or the discussion period, you can raise your hand and we can unmute you. So at the end, we'll have a round robin where we like to have some good communication with people about what's happening in your organization. In addition to this, I just want to share a little bit more about the CTS councils. One of the main purposes of CTS councils is to create a forum for practitioners and researchers to get to know each other and share trends and issues that they're seeing. You know, this collaboration really leads to better research projects and problem statements. So by sharing research, being able to ask questions and then think about future problem statements, it's a good chance to get to know each other and build relationships. So with that, why don't we go to the next slide? And good news for all the planners that need AICP credit. We do offer AICP credits for attending this. So if you'd like to have credit for attending today, you can go ahead and put a note in the chat. And if you put that towards the panelists and put your name and your email address, we can email you the forms for how to get those credits. And then next slide. So a couple of things before we get started too, we want to let you know about some additional opportunities. Transportation research is broad, and there's a webinar coming up on April 19th. The time is yet to be determined on the electrification of the freight system. So that's a pretty exciting topic. And then on April 21st, there's a presentation on pavement management, so another important topic for transportation. And then lastly, on May 9th, it's planned to be in person unless there's some new changes with COVID policies, but there will be a virtual option as well if you want to attend the presentation portion. But this is the all councils meeting that happens once a year, so it's kind of taking all 5 of the councils and our topics and addressing a topic. This one is on the troubling trends of traffic fatalities. I think we've all seen a lot of headlines about the increase in traffic fatalities and injuries and speed and whatnot. So we'll approach the conversation from the perspective from all the councils at that meeting. So registration information is coming soon on that, but everyone's invited if you'd like to attend that as well. So, and then lastly here we've got we want to know if there's any students today. So CTS is another way for not only practitioners and academics to get to know each other, but it's a nice way for students to get a glimpse of the real world. So if you're a student, please put in the all panelists chat message that you are with us today. So with that, I already mentioned Nissa and Yingling are the presenters today. Nissa is going to get us started. So with that, I'll pass it on to Nissa. Thanks.
unmute myself. Can't start off being muted. You can see my screen then? Okay, great, thank you. So good morning, everyone. Thanks for joining us. Nissa Tupper with MnDOT. And I have the great privilege to kick things off. I think the star of the show here is Dr. Yingling Fan, but I will tee things up a bit. And first, I just want to introduce the division that I work for at MnDOT. I'm not sure if everyone's familiar, but we do have a sustainability and public health division, which is really exciting. We're one of very few DOTs to really structurally elevate the areas of sustainability and public health. And so our team focuses on a couple of core things, including reducing transportation carbon pollution. We know that transportation is the #1 source of carbon pollution in Minnesota, so we certainly have a role to play there. We also do a lot of work around walking the talk in terms of how is our agency empowered and leading by example on sustainability efforts, especially in terms of our fleets and buildings. We also work on climate resilience. A lot of this work focuses on adaptation efforts in terms of what's happening to our infrastructure when we're thinking about the heavy rainfalls and the warmer summers and the toll that takes. What I'm here to talk about today is what you see in the purple part. That's what I focus on is how do we embed public health and equity into our decision-making processes and support better health outcomes. And this is really important. The transportation system plays a really influential role in our ability to achieve our best health. Primarily, it impacts our ability to be safe when we're outside, access to jobs and essential services like healthcare, healthy foods. It impacts the air we breathe, the ability to integrate physical activity into our lives. And there's so much more, but unfortunately, not all Minnesotans have an opportunity to experience the positive health benefits from our transportation system. We know that our state is home to some of the starkest disparities in the country, and that really does undermine our ability to allow everyone access to what they need to be healthy. And so health tied with equity are really important for MnDOT in terms of how do we shape a transportation system that will improve health for everyone, especially those who have been disproportionately impacted, including people of color, American Indians, people with disabilities, and people living in poverty. So public health and transportation, I think, are both in the midst of a transformational change. The previous Minnesota Department of Health Commissioner, Dr. Ed Ellinger, shared a presentation at a CTS research conference in 2013. And this was one of the images he shared as part of his presentation about the intersecting fields. And I think, you know, we're shifting things, but this perspective still holds true and resonates today. Medical care is critically important to our health. But when we look broadly, about 10% of our health outcomes are explained by medical care. So when we think about what shapes our ability to create health, we certainly need to think more holistically. And that's where public health comes in. The public health focus has been shifting more to an upstream prevention model, really integrating health in all policies, recognizing that many of the influences of what affords us the ability to achieve our best health really happen in tandem and outside of quality medical care. So, I mean, I guess boiling it down, it's really about where we live, work, and play, and it's about how we structure our communities to provide access and healthy environments to support our health. And that's both built and natural. So transportation is a built environment. We're still shifting from a model of one that moves cars to one that moves people, and focusing on that people part through safe, convenient, reliable, affordable system to make sure that we're connecting people to what they need to live a quality life. So originally the Minnesota Department of Highways, what is now the Department of Transportation. So Department of Highways was created in 1917 with the mission to locate, construct, and build highways. So to move cars. And about 60 years later, the name and focus shifted to the Minnesota Department of Transportation. So what does this mean? It's really about multimodal. And it's about people. So in addition to roads and bridges, the DOT develops and implements policies, plans, programs around aeronautics, freight, ports, waterways, public transit, railroads, walking, bicycling. But bottom line, transportation is about people, and we really can't forget that. We have a tremendous opportunity to really reshape our approaches and partner across fields to make sure that we're creating infrastructure and improving health and equity at the same time. So transportation organizations across the US have been increasingly incorporating health into transportation planning. At MnDOT specifically, here's a starting list. I find it encouraging that I joined about 2 years ago, and many staff are already actively making shifts to prioritize people who are moving on our system and to think about health and equity and intentionally work to improve those outcomes. We have a well-established working relationship with the Minnesota Department of Health. And there's also a number of projects and initiatives and structural changes happening to prioritize health and equity. And I'm not going to go into detail about a number of or about these things today, but the point is that we're building momentum. And as we're building momentum, we have an opportunity to do what's in the green here. To shape our narrative around, what's our role with transportation and health? How do we talk about it? What do we understand about it? And also, what are the guideposts to informing our efforts? And that's part of what you'll hear about today from Dr. Fan and what inspired that research to happen. But before I get into that, just wanted to set the stage about the social determinants of health. I think some folks are probably familiar with this, but our work over the past years at MnDOT has really been grounded in the social determinants of health, and I think it will continue to evolve from this. This is a public health model that emphasizes the conditions of which people live, learn, and work are what really truly affect the wide range of health and quality of life outcomes. So this acknowledges that our ability to achieve our best health is determined largely by the decisions in those three bands working from the outside in. So social, economic, and political factors like racism and access to participation in decisions, natural and built environment conditions, so having clean water, clean air to breathe, living and working conditions like having access to quality education and safe places to live. So policies and decisions made in these upstream areas really have a greater influence on our health than our individual behaviors or factors. About 60 to 80% of our health is really determined by factors that can be changed. So we think about those social, environmental, and living conditions. So setting up that access and opportunity. And then it's also important to understand how equity is present in these upstream determinants. So, our transportation system, services, decision-making really plays a role in either helping or hindering the lives of people who especially have been traditionally underrepresented or overburdened. So that's where our research project came in. We wanted our work moving forward to be informed by the social determinants of health model and support our work to identify, what are those multifaceted connections between transportation and public health? How does that inform our work? So this was a short turnaround research project. We started last year and had the good fortune to work with Dr. Yingling Fan. And these key questions is what the work really centered around. What are those pathways, making that connection? How do we conceptualize a framework to navigate those pathways and inform our approach moving forward? And then also, what are other organizations doing? What can we learn from? So there were three components to the research: a literature review. We had a transportation advisory panel to provide input. But the research review included both academic and gray research. There were semi-structured interviews with a number of organizations. And then this all culminates into a report, of course, and I'll let Dr. Fan provide more detail on that, but know that we will have the final report available on the MnDOT website soon. And you can also email me if you're interested, but check there for additional information. And with that, I will close out and I think hand it over to Dr. Fan. Thank you.
Thank you, Nisha. Let me share my screen here. and is my screen looks okay? Okay, great, thank you. All right, so I'm very excited today to talk about the Health and Transportation Nexus, which is the project that NISA's office, the MinDOT Office of Sustainability and Health actually funded. As you can see that, we developed through the project, we developed a unified model integrating multiple mechanisms for collaborative and equitable planning. So I put equitable in the title is because that once we integrate those multiple mechanisms into this model, it becomes apparent that, you can, health and equity are quite inseparable. I want to mention that and acknowledge that I had the privilege of working with a group of practitioners, and leveraged their suggestions when it comes to delivering the report. I also worked with Pei Yu Hua, who is a RA, who was an RA with me, and she already graduated on the project. So as you can see that besides Nisa, I also worked with Abdullahi, Amber Dowman, Brent Roscoe, Carl Dove, Christine Neary, David Elwin, Kelly Corbin, Liv Harrison, Lindsay Brewer, Patrick Hollister, as well as Sarah Dunlap. And I just want to mention that it was such a great experience working with this distinguished group of practitioners. Okay, so I wanted to start with my presentation. Start my presentation with a quote from William White, who mentioned that the street is the river of life of the city, the place where we come together, and the pathways to the center. Often that the idea that the streets or our transportation infrastructure is the pathway to the center, it offers mobility and accessibility, is widely acknowledged. But I think it is only recently that the streets are being considered and our transportation infrastructure being considered as the place where we come together. So when we think about, when we apply a human-centered approach, when it comes to looking at the intersection between transportation and health, we can find out that transportation is very much unique when it comes to being one of the social determinants of health. So how transportation, is unique when it comes to being social determinants of health. So as Nisa mentioned that, social determinants of health are non-medical factors that influence health equity and health outcomes. And typically, we consider conditions in which people live, learn, work, and play, those environmental factors as social determinants of health. And the social determinants of health are shaped by complex interrelated social structures and economic systems. So there are many versions of the social determinants of health framework. So I'm currently using one of the popular versions here, that typically there are 5 categories of the environmental factors being considered as social determinants of health: education, access and quality, healthcare and quality, neighborhood and built environment, social and community contexts, and economic stability. Now, where is the transportation here? Right, transportation is certainly part of neighborhood and the built environment category there. So the physical presence of transportation infrastructure directly shapes the social and physical environment in many ways. You can see, certainly that the transportation shapes social and community contexts as well, on top of just simply shaping the built environment. In addition, as we mentioned earlier, because the transportation offers mobility and accessibility, transportation also determines the types of places where people can live, learn, work, and play in their everyday life. So besides just shaping neighborhood built environment and the social and the community context, transportation also determines that whether you have access to quality healthcare, whether you have access to quality education, and whether you have access to economic opportunities. So transportation, if you think about kind of how it connects to all those opportunities and shapes our physical and social environments, it's a very essential social determinant of health. So I put two pictures here, essentially just to illustrate that how transportation shapes physical and social environments and determines mobility and accessibility. So as you can see that, the I-35W interstate highway, I mean, this is essentially, transportation providing a pathway to the center, right? It's, the mobility and accessibility function is very much emphasized, in the left picture here. So in the right picture here, you can see that this is where not only providing mobility and accessibility, our transportation version sidewalk, the streets, but also provides a place where people come together, right? So it gives you different lived experience when you are in this type of environment, right? So that's an example of how transportation not only determines mobility and accessibility, but also shapes, our physical and social environments. Besides social determinant health as a conceptual foundation for the work that we have carried out, I want to mention that another set of theory that very much informed this, our work in this project. So this additional set of theories, we can, it can be called as critical theories in sociology. So the idea of there are many critical theories out there. There's a critical race theory. There's also a feminist theory could also be considered as a critical theory as well. More recently, we also have a critical disability theory, so which focus on that how people with disabilities are being excluded from our society, when it comes to social and economic opportunities. So the central theme of critical theories, regardless of whether it's focused on gender, focused on race, focused on disability, or focused on economic class, the idea is that in our society, sexism, racism, and classism are prevalent in everyday life. And it's very necessary to study the lived experience of real people. I mean, so basically that to be human-centered, to reveal and challenge power structure. Often the power structure, brings social injustice to our everyday life. So it's very necessary to make the perspective of socially marginalized groups rather than those of dominant culture, the central axis around which discourse revolves. So how can we bring this set of theories in sociology to study transportation? And the extension actually is quite natural. If we want to extend this set of theories to transportation, we can, we can simply look at how much of our transportation systems are socially constructed by the dominant groups. And it is true that our transportation system, especially our current historical and contemporary transportation system, are socially constructed by often by the dominant group. So therefore, there is embedded injustice, systematic injustice in our transportation systems. So to give you some example, I mean, historically, there are a lot of examples that the transportation presents operation and the exclusion, right? So the historical examples are illustrated in the pictures on your left. And certainly that transportation was an instrument that used for racial segregation in the United States, especially in the South prior to the civil rights movement. So in our contemporary society, you may have the question, well, we no longer, segregation is illegal right now. Does that mean that transportation no longer presents operations and the exclusion? So in contemporary society, that how transportation presents operation, the exclusion is much more subtle and more ordinary. So I give you a illustration here in the pictures on your right side. Those are the two pictures that I took during my field trip to Arlington, Texas, which is I believe the 7th largest city in the state of Texas. And I've shown this picture in a couple of presentations already, so you may have seen this picture from my previous presentation. But it's very telling that when you go into the city hall, and there is this human-shaped sculpture in the center of the lobby. But when you go into the city hall from the front door, from the sidewalk, you actually see the back of the human sculpture rather than see the front of the human sculpture. I mean, when I entered into the lobby, I did not feel welcomed because the sculpture is purposefully placed kind of not welcoming me, because it's faced towards the back door. So I quickly realized that it was strategically placed to face the back door to welcome people who coming from the parking lot, right? Who drive to the location and come into the city hall from the parking lot. So, I mean, this experience is very small, but it's very telling that how transportation is an unavoidable everyday life component that still presents operation and exclusion in subtle and ordinary ways. Now, I can give you another example how transportation creates very different lived experience by gender. When you think about people's waiting experience as bus stops, females have a very different waiting experience compared to male, especially in unsafe environment. In addition, researchers who study how to make downtown facilities more gender friendly, they find out that one particular facility type that female feel very uncomfortable with actually is a parking infrastructure in downtown. So there are a lot of transportation infrastructure components that create very different lived experience by race, by gender, and by class. I mean, certainly that the experience I had in Arlington, Texas, that is different lived experience by the type of transportation mode you use. But at the same time, so we know that, our modal access differ by race, by gender, and by class. So this is just an illustration of our previous work, how to map people's lived experience onto streets and roads. This is the transportation happiness map we created using preliminary data in the Minneapolis-St. Paul region. This is a way where we could, help transportation planners to identify how the transportation infrastructures are creating different type of lived experience. But what this map doesn't do is that to reveal kind of whether there are happiness gaps or well-being gaps when it comes to gender, race, and class. So what we did using the same data set, so we look at people's emotional experience during trips. And then we look at whether there are differences by gender, by race, and by class. Here, I'm just using income as the proxy measure of social class here. And you can see that there are gaps between female and male, between non-white and white, and between low income and high income. And that all the gaps are significant, and with the dominant group have higher well-being when using transportation infrastructure compared to the disadvantaged groups. So I think this is something that that we needed to know, that besides that many of the ideas that how transportation shapes health through kind of environmental pollution, through active transportation providing physical activity, the fact that the transportation is so central to our everyday life, and the fact that transportation that significantly shapes people's lived experience makes a direct connection between transportation and health. So, now getting back to the project that we did, with MinDOT here, we did, as Nisa mentioned, that we did a literature review, and we identified 8 frameworks that are out there that very much, is very much about connecting transportation to health. There are also 3 tools that are developed, in the US as well as outside the US, try to measure the health impacts of the transportation infrastructure. So we reviewed those 8 frameworks and 3 tools out there. And in the report, we actually have provide citations so you can access, see the web link where you can download those the documents about those 8 frameworks and the 3 tools. What we found out is that, so for example, one of the framework is this health in transportation corridor planning framework. What you can see is that in the framework, they will talk about the specific domain areas, how transportation connects to health. So one domain area is that transportation could help to reduce obesity rates. So emphasize physical activity that can be gained through transportation. Transportation is essential when it comes to decrease vehicle emissions, so emphasize the environmental pollution component. Transportation can be designed to benefit aging population as well as lower income people. So this emphasize kind of the equity dimension, the equity domain. And then, transportation can be designed to promote more bicycle trips, more pedestrian trips, and certainly that promoting more bicycle trips and pedestrian trips can decrease the vehicle, make transportation greener, and also, reduce obesity rates, promote more physical activity. So it's very clear that in each of those tools and frameworks, that they will identify very specific domain areas where transportation and health, their connections are quite evident. So we actually did, we look at each of those frameworks and the tools. We identified the following key domains that have been mentioned in those 8 frameworks and the 3 tools. So F1 is basically framework 1, F8 is framework 8, number 8, and then we have T1 as a tool 1, T3 as tool 3. All the frameworks and tools mentioned active transportation as a key domain. And also all the frameworks mentioned environmental pollution as a key domain. All the frameworks and tools mentioned traffic safety as a key domain. But when it comes to the other domains listed here, some frameworks mentioned, but some frameworks did not. So for example, access to destinations, equity, public transportation, mental health, and well-being being mentioned in only 3 frameworks. climate change mentioned only in 2 frameworks, and the resilience to cluster is mentioned in framework number 3, but not in other framework or tools. We also did a word frequency analysis. So we downloaded all those documents that describing those frameworks and tools. Then we put all those digital copies together into a software to analyze what are the most frequently mentioned words in those documents. And the results is very similar to the table I just presented, that frequently mentioned active transportation, physical activity in particular, frequently mentioned safety, traffic safety or road safety, and frequently mentioned pollution, particularly air pollution. Certainly there are other words frequently mentioned, but the words that most frequently mentioned are presented in the center there. So after reviewing those frameworks and tools, there is a question that coming to our head. So basically, existing frameworks describe the transportation-related domains affecting health and equity. But what about the mechanisms through which transportation-related domains affect health and equity? So we find that the social determinants of health, to some degree, I mean, it's very helpful identifying, those 5 categories of determinants. But it's inadequate to some degree, because it does not provide us more information, about how those, 5 categories affects health and equity. And in our case, we are particularly interested in how those transportation-related domains affect health and equity. So we started doing more, reviewed more literature, and particularly focusing on the mechanisms out there that could help to explain the transportation health connections. So we identified 3 major mechanisms. The first one is the environmental health mechanism. Environmental health mechanism here emphasizes the protection of people from environmental hazards. And you can imagine that the transportation actually are directly related to many environmental hazards, not only air pollution, but also water contamination as well. There are also noise, environmental hazards such as traffic accidents can be considered as environmental hazards as well. So there is a paper actually we found that summarize all those environmental hazards out there. So you can see that on your right side, this framework identified the transportation related environmental hazards, contamination, social exclusion, noise, urban heat islands, motor vehicle crash, air pollution, community surveillance, electromagnetic fields, stress, and the greenhouse gases. So those are the transportation, environment hazards, particularly transportation related. It's also become apparent that if we look at this particular mechanism, that it is intrinsically linked to social equity and justice issues, because those transportation-related environmental hazards disproportionately affect areas where the most disadvantaged reside. And there are actually tons of empirical evidence showing that, and in the a body of literature that talks about environmental justice issues, that how transportation-related environmental hazards are disproportionately, located in low-income minority communities. Then the second major mechanism we discovered is the so-called behavioral health mechanism. It is supported by a growing body of evidence documenting how land use and transportation can support or hinder healthy behavior, such as physical activity and a healthy diet. So In the picture showing here, this is, we grabbed it from a paper we read. If you look at the behaviors, there are 3 major behaviors that are considered related to transportation infrastructure. Dietary intake, physical activity, and social interaction. So those are the 3 types of behaviors that can be considered as a pathway from from transportation infrastructure to health outcomes. The behavioral health mechanism places a heavy emphasis on obesity and the associated chronic diseases, such as cardiovascular disease, respiratory illness, type 2 diabetes, and poor mental health. Now, it's very interesting that in the picture here, that the researchers, they integrated the behavioral health mechanism with the environmental health mechanism. So the behavioral health mechanism is illustrated in the behavioral box, but the environmental health mechanism is summarized in the exposures box under the behavioral box right there. But again, this the researchers in this paper did not do kind of as comprehensive work as the other paper I just introduced, where they identified about 8 environmental hazards that are transportation related. Here, just focusing on 3: air pollution, traffic safety and crime, and noise. So you may have the question, why integration, right? Without considering both behavior and exposure-based pathways, the overall health impacts of transportation are likely to be misestimated. So I'm just using a very simple example. In reality, there are many other examples out there that can illustrate that it's very important that we always try to integrate those mechanisms when we consider the health impacts of transportation. So this simple example here is basically, well, let's say we want to, we want to activate the behavioral health mechanism, right? We want to increase in regional investment in active transportation, and that will lead to, positive change, regionally desirable increase in physical activity. But if we don't, consider the environmental health mechanism, well, we may have unintended negative consequence. That is, increase the risk of injury and increase the exposure to pollutants through longer travel time and higher inhalation rates. So there are actually solid empirical evidence showing that the pedestrians in low-income neighborhoods, they tend to inhale more environmental pollutants than pedestrians in suburban neighborhoods. So it's very important that we consider multiple mechanisms when we try to study the connections between transportation and health. And also there is another illustration here is that behavioral health actually, although that increasingly that part of literature talks about the social equity issues, but it's not as prominent as in the environmental health literature, where social equity and social justice issues are very much centered in that part of literature. And then we want to add a 3rd major mechanism for your consideration, and this is a very important mechanism, and I think this mechanism has not been widely acknowledged in the transportation sector in the United States. In fact, this social exclusion mechanism has been widely acknowledged in West European countries. And in fact, the United Kingdom is the country that first kind of, their national government actually incorporated this model to promote accessibility to all kinds of opportunities for low income, for their low income population. So the social exclusion mechanism focus on, accessibility is very much centered here. But the accessibility concept here not only address access to destinations, to physical destinations, but also very much highlight and emphasize access to social networks, to social capital, to political decision making. Access to all kinds of opportunities. What's also kind of unique about this social exclusion mechanism is that it talks about how transportation disadvantage intersects with the social disadvantage. That people who tend to be disadvantaged when it comes to transportation, they also tend to be low income, not unemployed, and have low skills, or as well as have a low health status, poor health status, and also not necessarily have access to quality housing. So that's the two kind of major characteristics of the social exclusion mechanism, is that it emphasizes the intersection of transportation and multiple social disadvantage components, and talks about how inaccessibility affects all domains of life there. So because social exclusion framework, I think it's more innovative compared to the environmental health framework and the behavioral health framework, which is more widely acknowledged in the U.S. Unfortunately, social exclusion hasn't been very much widely acknowledged in our transportation sector here. I had mentioned that. So, what are the innovations? I had mentioned that it recognizes that the transportation health connections operate in multiple life dimensions, right? But also it emphasizes the interaction between transportation disadvantage and the social disadvantage, acknowledging multiple intersecting deprivations. And because it emphasizes those intersecting deprivations, it actually moves away from the traditional systems-based transportation service provision approach towards a more people-oriented and needs-based social policy approach that focuses on accessing key life-enhancing opportunities. And more importantly, this mechanism highlights the importance of relating the problems back to how policy decisions and the practice of local authorities and the agencies may have systematically excluded certain individuals or communities from the benefits. This is a very important innovation, because I actually consider social exclusion, this concept is very much originated from what I mentioned earlier, the critical theories in sociology, right? It's very much about reviewing the power structure and how our existing power structure actually systematically included certain individuals and communities from benefits. So it raised the question about the systematic inequity in the distribution of transportation and non-transportation resources. And a similar concept is social isolation, but I think social exclusion is very much more, more upfront about this systematic injustice we have in our current systems. So working with NISA and the also technical advisory panel, that we kind of developed this unified model of health and the transportation nexus. And we have those 5 social determinants of health, and all come together, and then and also highlight those 3 major mechanisms that we identified: behavioral health, environmental health. We flipped the social exclusion concept and named it as a social inclusion, and so that everything goes towards equitable health and wellness, health and equity. That's our work, right? How we made the integration, create the unified model. So all 5 dimensions of social determinants of health are relevant to social transportation and health. So we kind of explicitly acknowledge that. We also acknowledge those three major mechanisms, and those three mechanisms can overlap and interact with one another to moderate the effects of social determinants of health on health and equity outcomes. So just for example, traffic accidents can be studied from both environment and behavioral health perspectives. Social inclusion affects the types of environment exposure to health risks and the environment context for behavior, and therefore intersects with the environment and the behavioral health mechanisms. So as Nisa mentioned that we actually interviewed representatives from state DOTs. We identified 6 state DOTs who are pioneers when it comes to linking transportation to health. California Caltrans and Rhode Island RIDOT, they are the pioneers because they actually integrated the public health components into their long-range transportation plans. Now, Massachusetts, Minnesota, Oregon, and Washington State also identify as the pioneers because they actually had dedicated programs to initiate interagency collaboration and promote collaborative health and transportation planning. So, given the time limit, I'm not going to talk about the specific interviews we had with those 6 state DOTs. But based upon the interviews, so we kind of provide, we come up with 4 recommendations. Basically, continue to foster partnership across all agencies and stakeholders outside the Department of Health. Develop MnDOT's definition of health and how it relates to transportation. And certainly, I think recognizing all those 3 major mechanisms that highlighted, in our report. Number 3 is, very much based upon our interview. Caltrans and Washington State and Massachusetts, those departments of those DOTs actually already developed a scoring and evaluation matrix for project selection and project evaluation. So for their transportation projects, they actually evaluate the health impacts and then develop the scoring. That's the scores and evaluations. And then number 4 is basically ensuring MnDOT staff is well-versed and trained in transportation and health concepts, like social determinant of health, and nowadays is much more, widely acknowledged compared to 10 years ago. But what about social exclusion? What about critical race theory, right? What about gender mainstreaming? All those concepts are very important concepts when it comes to linking transportation to health. And with that, I conclude my presentation and I welcome any questions.
Wow, thank you, Yingling and Nissa. That was fantastic. I'll say Nissa Tupper from MnDOT and Dr. Fahn from the university. My head is swimming with so many questions. This is amazing, and I've heard a lot and thought about how environmental and behavioral aspects can influence our decisions, but to put words around that social exclusion piece, those are the right language, recommending some practices and how to measure some things to monitor that whole social exclusion category, and I think at MnDOT we're starting to call some of that livability. So lots to think about here. And with that, I'm going to pass it on to Mary Carlson. She was able to join us. I mentioned her name at the beginning. So Mary, you're going to facilitate our Q&A here. So thank you very much.
Thank you so much, Lisa. Thank you so much, Yingling and Nissa. As a reminder, just the housekeeping, if you would like us to unmute you, go ahead and raise your hand and we can unmute you and you can ask your question verbally. Or if you would like to, you can also type a question into the Q&A box in the bottom, or on my screen, it's on the bottom toolbar. So starting out, I want to acknowledge a comment that was provided early on in the presentation. And I think it's really important the issue is the issue of obesity rates and acknowledging that and embracing that we don't want to fat shame people. And so one of the things that we know is that there is a connection between obesity and health outcomes. And I'm wondering, in the work that you all are doing and you're leading, how are you helping us as transportation practitioners know that obesity can be something we monitor as a metric, but we don't place judgment on people for the shapes of their bodies? So yeah, have you had any conversations around that as part of this work?
Yeah, I can try to answer that question. So there are many ways to measure, so when we talk about the health benefits of physical activity, right? And the health impacts of physical activity can be measured in many ways. Traditionally, it is being measured by BMI, the body mass index. So it's very much about obesity. But nowadays, I think, so for example, like the CDC recommended physical activity level, it's not centered around the BMI body mass index. It is centered around that, you should at least get kind of a 60 minutes of moderate or vigorous physical activity each day. And then they actually provide the types of moderate and vigorous level physical activities, the examples of those physical activities. So Mary, I definitely agree with you that it's a very important, and I think when it comes to research is basically how can we develop more accurate measures of physical activity and the health outcomes. I do see that in the literature, especially active transportation literature, that people are moving away from. I wouldn't say certainly researchers are moving away from just using body BMI as the measurement, and that they are now incorporating much broader range of health indicators.
Thank you, Yingling. Nessa, anything that you want to add from conversations at MnDOT, or does that kind of cover where you all are at too?
Yeah, I think that was a great, great explanation, Yingling. So I don't have anything to add.
Okay, great, thank you. All right, our next question is, as part of this work, we are hearing MnDOT discussed a lot. How is Metro Transit part of this conversation, or what might next steps look like for incorporating Metro Transit into this conversation?
Sure. So Metro Transit, our relationship with them is through planning and projects, and that's primarily through our Metro district. So I think there are opportunities there when we think about, our multimodal transportation system and how do we, center the values of safe, affordable, reliable, convenient. And so there's certainly an opportunity there. We haven't had excuse me, I have a frog in my throat, specific conversations around, I guess, this research project with Metro Transit, but I think there's opportunities there, and there might be also some work happening with the livability framework that my colleague Gloria Jeff is leading through the Metro District as well. So I think there's lots of opportunity there, in short. And Gloria, feel free to chime in if you'd like, and Yingling, I see you have something to add.
So I will just quickly add that I definitely think that public transportation play a very significant role when it comes to maximizing the health benefits of the transportation. And if we look at kind of those three mechanisms, right, I do think there's tons of research about how public transportation can make our transportation system greener. There are also a lot of research showing that transit users are actually more physically active compared to people who depend upon cars. So behavioral health and environmental health. There are also a lot of research showing that especially for people who don't have access to cars, elderly people or couldn't drive cars, elderly people, low-income people. People with disabilities, like public transportation is their only way to get access to a lot of the to participate in social and the political life. I mean, it's you know, if they don't have public transportation, they can only walk, and our you know, communities are not a lot of our communities are quite walkable, so they will have a complete isolation, and that is the exclusion. And I think that's, you know, so just simply recognizing that how public transportation, you know, can help to reduce the social isolation of certain, particularly the more vulnerable population groups, is not enough. And then we needed to think about public transportation as a public spaces where, as William White mentioned, is that where people come together, right? So if you think about social interactions, right? You know, public transportation is a very important public space where people of different background, different race, different gender, and different class come together. And I think that, you know, fundamentally, I think our policymakers need to ask the question: what kind of cities do we want to create in the future? And if we want to create a more livable cities and more socially inclusive cities, we got to invest heavily on public transportation. But again, I mean, the format of transportation, public transportation also evolved, right? So right now, I think we needed to be thinking about, you know, those emerging shared mobility modes. Those modes can be considered as a public transportation modes. So I think there's a lot when it comes to we can talk about when it comes to transportation health and you know, public transportation.
Thank you. I'm just doing one housekeeping thing here, so apologize while I'm typing and talking at the same time. Thinking about those communities that we want to build now and in the future, and a really important question that we got about race. I'm going to read the question and to give everybody just a minute to respond, to gather thoughts before you respond. The question is, how do you address the fact that Black males often, or walking, are often viewed as probably engaging in illegal activities? Recreational facilities where Black males gather are often viewed as unsafe. How are the Black males supposed to improve their health if engaging in basic physical activity like walking will cause them to have a potential fatal interaction with law enforcement? The safe option for these people, for this group of our population, would be to minimize engaging in physical activities. So very, very real tension that we are facing in not just Minnesota, but especially in Minnesota right now. So again, the question is balancing personal safety with physical activity, especially for our Black male population. And I see that Gloria Jeff has her hand raised.
And this is Katie. I just unmuted Gloria. So if you wish to add verbally, feel free.
The question gets at the fact that we have this idyllic view that, of course, people want to be able to walk. How many stories have we seen in the last 2 years of Black males being accosted by law enforcement because neighbors said, there's a suspicious Black man walking in my neighborhood.
Mhm.
And all they're doing is walking. They're not casing a house to steal from it. We had the wonderful example in Georgia where the man was jogging, quote unquote, physical activity. And private citizens took it upon themselves to not just do a citizen's arrest, but to take his life. So when we do this sort of idyllic conversation about, oh, all you need to do is, we have this obesity problem. Let's make it possible for folks to do more walking. Let them ride public transit without the realization that everybody doesn't have a college degree. And that if you are, let's say, a carpenter, let's talk about public transit getting you to your various work sites. Because very easily in the summer, if you are working on a construction site, whether it's vertical or horizontal, your work site may change. You may need to be there earlier than public transit has options available to get you there. So should you accept the fact that you simply need to be low income and not have that skill set because those jobs are not convenient and easy for public transit to serve? And these are not outliers. These are part of the mainstream of questions. I think it's important that we talk about public health and transportation, but let us not confuse the idea that if we take care of public health, we take care of the equity issues.
Great points, Gloria. Great points. Tough questions.
Yeah,
Very
definitely.
tough questions and incredibly important questions. Nissa, Yingling, how have you all been thinking about this and these questions in the work that we're doing now?
Yeah, I guess I mean, I agree, Gloria. I think equity has to come first before public health. Like, we can't advance public health until we advance equity. And that really, we have to center our work there. And I think two initial thoughts, not complete answers here. But one is, we have to think about our transportation system and how are we creating choice and redundancy? So we're not forcing people to take one mode or another, but we're providing accessible and affordable, safe, convenient, redundant options, right? Yes, there are many jobs that require use of vehicles. We need that to support our economy, to support our communities. Yes, there are some folks that want to and can walk places, but there are some that can't for perceived or real safety issues, mobility limitations. So I think it, really requires us to think about our holistic system. And, at a high level, what's our system look like? Where are gaps? But then being true to community context, right? And doing the due diligence of understanding what is the context, who are the people that are using this transportation system, what's priority for them in terms of their health and equity concerns, what role does our transportation system play? So for MnDOT, we have an opportunity to be a leader on infrastructure, but we also have an opportunity to be a partner, to be a facilitator, to convene those who have more ability to shape what's outside of the transportation right of way, but we can help bring those issues to the forefront, especially as a state agency. Infrastructure projects don't come around every year in the same community. So what's our opportunity for that once every 30-year project, or to make an impact and to hear the community and to elevate that work. There's one project that we're working on right now, piloting an equity health assessment, and that is central. Is how do we elevate lived experience and priorities of community members who are in that corridor, who live, work, and have homes in that, or businesses in that corridor. How do we elevate what they say are priorities and feed that into the public input process to help to round out that data and that modeling that we do, right? So how do we listen more deeply? And I think, and also accept that often will put us in an uncomfortable space as professionals, and that's okay. Because at the end of the day, again, like going back to the very beginning, we can't forget that we're designing for people. So what do the people need? What's important to them? What's meaningful? And so I think it's, shifting a lot of the way we define and approach things. So that's just a preliminary, couple preliminary thoughts to that. But I think Yingling, you had some things to add.
Yes, so Gloria, I think that's a very important question, and I would say that it's a question that is extremely relevant, given this, our the society we are in, and I do think of social exclusion, that particular concept and mechanism, concept, and and the critical race theory can help us to to have, to frame those, to frame those questions or research inquiries, because ultimately, I think when you say, ultimately, when we talk about cities, talk about transportation spaces, public spaces, supposedly everybody should be able to access streets. Everybody should be able to access public transportation. But in reality, that, whether you, how comfortable you are accessing those, those infrastructure or facilities often depend upon what you wear and how you look, right? So that's social exclusion, is because that there are norms like constructed by the dominant race or dominant cultural groups, about giving you those indication. It's not appropriate for certain people to do certain things in this space. That's exactly what social exclusion is about, is that how can we eliminate social exclusion? It is supposed to be public space that is should be accessed by anyone, anytime. So I think if you ask what can we do, I think as researchers, in one of the slides where I talk about the critical theories, I talked about the two important things. One is develop experiential knowledge, understand the people's lived experience, right? Human-centered approach. There's another piece which is super important, is centering the margin approach. Basically, we need make those, we needed to do storytelling. We needed to tell people that, how the more vulnerable population groups or underserved population groups feel when they're utilizing those transportation infrastructures. So I think it's very important that in whatever way possible that we tell people about kind of how walking experience of Black male, what does that look like? Right, how they feel when they, they actually feel super unsafe when they walk in, in the neighborhoods or in the areas. So I do think that the social exclusion framework, if we can apply that more into our research and the practice, if we can study more about the, underserved populations, the better.
How do you balance that in with, and I'll talk about transit. There are lots of advocates for public transit. I'm one of them, but I'm also realistic about transit has to make decisions that reflect their revenue sources. And so they find themselves frequently with late night service, being one of the areas where their ridership is low and their traditional action has been to say, well, we only have 10% of the available seats on this route being utilized after 12:30. So we'll eliminate that service because there clearly is not much of a demand, as opposed to who are those 10% that are riding at that late hour? Could it be that they have no other options? But there is not that piece of investigation that's done. Yet the lived experience is those folks don't have an option, which is why they're still riding transit at that late, potentially unsafe hour of the day. Yet the reaction is, oh, there's not enough demand, therefore we can't afford to operate the service. How do we change or even address the issue of they've got to generate X amount of dollars from the fare box in order to be eligible for federal funding? And if by maintaining that service, they're not getting the fare box revenue that they need. I agree that we need to focus on the margin, but we have somehow or another got to get folks engaged in the activity that don't reflect the privileged class of those of all of us on this call, but deal with when was the last time we talked to that person that's on the bus at 12:30 at night about why are you on this bus at 12:30? Is it because the only job, this is, I'm coming home from my second job and this was the only, and I had to have the second job so I could afford to pay the rent in the school districts so that my kids can get a quality education. And that's why I'm on this bus and I don't have a car or I can't afford to use the car anymore because gas prices are up to $4 or $5 a gallon. I mean,
Exactly.
it's that conversation. We don't do that. And how
Gloria.
does this work help us advance that?
Absolutely. So this is Mary Carlson. You're speaking to the issue that I have focused my career now on. And I'm really curious for Yingling and for Nissa, how you're looking at mobility as a service. Because like Gloria said, fixed route transit is inefficient in certain contexts. And the opportunity that I see with mobility as a service, and we're seeing this outside of the United States, making some really important progress and really addressing that social exclusion issue or really promoting the social inclusion issue. How are you thinking about mobility as a service in this work? And then I think to Gloria's point, how are we thinking about that here in Minnesota from an implementation perspective? And if you want help with the implementation perspective, I'm happy to talk with you about work that Minda and the council and others are doing.
I can try to answer this question. To me, someone who studied public transportation, I actually think that mobility as a service is not an innovation, or the Uber is not an innovation because we had it. We have always had it. We had a demand responsive transit. If you're not familiar with that category, it's a paratransit. For people with disabilities, they can call a number and then, the demand responsive transit actually provides, it's a type of public transportation service, provides door-to-door transportation service in a much smaller vehicle. However, we did not, despite that we had this, have had this demand responsive transit for a very long time, that we did not get to the stage like, make those demand responsive transit look like Uber. So I think in the future, public transportation sectors can certainly work with, Uber, develop Uber-like services, either develop Uber-like service or work with Uber to choose, I think there's a potential of balancing both kind of efficiency as well as the fact that there are people who really need to get from point A to point B at this particular time. And also, I think we should be pushing forward for fare-free public transportation. I think, if you really have, really think about public transportation being so central for social integration, like for a person to function in a society, I think we need to provide, public transportation at a really affordable price. And to some people, affordable means fare-free. I think a lot of people, people like us who have a lot of privilege, have monthly, stable monthly income. It's hard to understand why you needed to make public transportation free. But I think if we look at the lived experience of many of the unemployed, that's their way of getting the next job opportunity. That's their way of, caring, providing good care for their families.
Nissa, anything you want to add from department's perspective?
Yeah, well, so there's I think there's likely some other folks at MnDOT who are working more in the shared mobility space and have more expertise in that. So I'll tread lightly there because I don't have deep knowledge. But there, there's an example, and I think that just this begs the question of how do we think about our transportation as a system that can best service the users, right? So I think, that challenges us as professionals to always be thinking about what are we continuing to do, and should we be continuing to do that? What are the opportunities we can seize, and how do we do things differently? I just learned about a project in Dakota County where, because of COVID, their door-to-door disability service transitioned from, the traditional model of here's the bus and we'll pick you up, to giving, I believe it was Lyft cards to participants, and the satisfaction, the reliability, received much higher marks than they had before. So that's something they're continuing. So I think there's opportunities for us here to think creatively, like you said, about our transportation system, and who does what and who are we servicing. I think also, to the point, Gloria mentioned, how do we take this work and think about, better engaging and servicing those who don't have options. I think that's on us as professionals to bring that into every space we walk into, because we have a seat at that table, right? So to ask those questions and of ourselves, of our partners, of our colleagues, and to challenge, where are we getting this information? What are the assumptions we're making? Who have we talked to? Who have we not talked to? And being willing to bring that to the table, to make sure that we're opening up those seats, right, to understand all those different perspectives. So that's just all I'd look to add at this point.
Thank you, Yingling. Thank you, Nissa. Thank you, Gloria, for some fantastic questions. I just want to encourage us to keep asking those questions. Like Nissa said, every time that we have an opportunity to open up the table, that we do so. Acknowledging that we have about 5 minutes left in our time together today. We did not get to all the questions in the Q&A right now. So just want to encourage all of us to stay part of this conversation. Clearly, Nissa, Yingling, there's hunger for it as part of our community. Right now, I'm going to just transition to and hand it over to Lisa. And Lisa, can you finish out our session today, including leading our round robin?
Thanks, Mary. I'm just looking at the calendar invite, says we go till 11. So I don't know if people have time to continue with talking, or if we want to go with what the announcement in the email said was 10:30. So I guess first, people can hang on and talk if we want to continue the round robin, but acknowledging that invite said 10:30, so being respectful of people's time. So before we start that round robin, we want to make sure that we introduce our CTS partners here. Gina Boss and Katie Kirk are on the call here today. They're going to unmute and wave, and we might have Katie here they'll turn their cameras on and wave, and we might have Katie unmute for a minute. Mary and I want to take an opportunity to really thank Katie for all her work at CTS. Oh my gosh, you've been with CTS for 12 years and you're leaving at the end of March, and all the behind the scenes planning and coordinating all the meetings, and then helping us find relevant transportation topics. It's Katie's been our liaison for this council, and I just really want to hold her up. Mary, if you want to say anything before we let Katie say a few parting words.
Go ahead, Katie.
Yes, thank you. It's been a pleasure to be at CTS this more than a decade, and I'm very grateful for my time here, and also working with all the external partners like you all. And truth be told, this is one of my favorite councils to support. The planning and the economy really close to my heart, given that I have a planning background. And today's topic was very insightful, and I really appreciated it. So at this time, I'm planning to just take some time for a personal sabbatical and spend some quality time with my family and just pause. And I have aging parents, so and children, so I've got a lot going on, and looking forward to summer. And again, very grateful for my time at CTS and for everyone who I've met along the way. And feel free to keep in touch on LinkedIn. So thanks, Mary and Lisa. I'll turn it back to you.
Great, thanks. So like I said, I think the calendar invite has us going till 11. So if people still have time, we can continue talking. And if you need to hop off at 10:30 because you saw that's fine too. In this round robin portion, like I mentioned at the beginning of the call today, we like to hear from people about transportation issues that may lend themselves to research at some point, things that relate to transportation planning and the economy. They could be related to today's topic. We can certainly, also, chat a little bit more about the presentation in this time we have, or it could be any issue that your organization is facing that you want to brainstorm and bounce ideas off of about transportation research. Again, this is a great time for practitioners and academics to sort of get to know each other and, fine-tune problem statements so they turn into even more helpful research projects. So it's round robin. So feel free to raise your hand if you want to unmute and share something, or if you put something in the chat, we can certainly read it off. And I think, Gloria, you had your hand up again. Is that right? It's not still up from before. So I don't know, Katie, if you can go ahead and unmute Gloria.
Yes, let me go ahead. Oh, there she is. Okay.
Oh, she's already unmuted. Excellent. Thank you.
My question has to do with, is there any research, or should there be research on the evolution of the definition of transportation going from being about the movement of people and goods to only about the movement of people? Is there some research that talks about how that evolution occurred and why? Because now we talk about transportation as being about moving people, and we seem to have dropped the element having to do with goods movement. And what's the evolution that caused that?
And Gloria, do you know if if there's any official definitions like out of federal highways or other, transportation bodies that give us guidance and direction, or is that just something you've noticed in the language people use?
It's in the language that people use. If one goes to pick your favorite transportation textbook, the definition of transportation is about the movement and people and goods. We are now no longer talking about moving goods. We are saying we must be very focused and almost exclusively focused on moving people. And that runs in the face of previous attention on the economic status of the city, county, region, or the nation, because it's all about how do we get people from point A to point B, the goods they need to consume, the work, the opportunity for work of particular types seems to not be the focus. And I just want to understand, and I think there needs to be research out there that talks about why there is a diminished focus on goods movement.
No, thanks for that thought. And I know, at least with this council, Mary and I are always trying to remind us, like, okay, we need to do some presentations on freight. I can't remember when the last time, Mary, we did one, but it wasn't too long ago. Talking about that transportation of freight and goods is really important to keep in mind. So yeah, that would be interesting research to think about how we can get back to considering that with all our work.
I just would like to jump in and really appreciate the question as well. And one thing we're discovering, as with many transportation topics and interests, is it is such an interdisciplinary topic, and we have potential expertise that we can tap, across the university, from the Carlson School of Management to the Industrial Systems and Engineering department at the university, obviously to the Civil, Environmental, and Geoengineering department. And we also have freight policy related research going on at the Humphrey School as well. So I feel like we are definitely poised at the university to contribute in that space more than perhaps we have done in the past. And there's also the Minnesota Freight Advisory Committee that MnDOT convenes and that CTS supports, which I think is another important venue to have conversations about the research that's needed, and then how we talk more holistically about that need as well.
So I wanted to add to that also appreciation for the question. There is a professor in industrial engineering, Saif. Gina, you probably know the last name.
Benjafar.
Benjafar, I think he is, looking at, how freight transportation is so central, will become very important, I think, post-COVID especially. And in fact, some of our public transportation agencies in the state of Minnesota actually use the buses to get, kind of groceries to elderly people during COVID. I certainly think that that's a very important aspect of our everyday life, especially going forward post-COVID, that people use tele-shopping more than before.
Any other topics that need more research?
Lisa, it looks like David Elvin has a hand raised
Oh,
here.
great.
I'll go ahead and
David, yep.
ask you to unmute. Go ahead, David.
Hey, good morning, everybody. I think I want to share that this research has actually coming to life. Many of the people on this call, Gloria and Nissa and others, have been helping me in the last year put together a community advisory committee focusing on the issue of safety and the impacts to people of color and low income. And just wanted to share that your support is coming to life. Next Monday, we're having the first meeting of our community advisory group for the Pell study on Highway 47 and 64 over in Northeast Minneapolis up into Blaine. And we're going to be drawing, I think, on kind of the equity review that Abdullahi put together for policy. There was an equity working group as part of the statewide multimodal plan. And I've adapted that with a focus on safety that Gloria was very kind to advise me on. So just wanted to say that it goes both ways. Research has real world, it's having real world impacts now. So I wanted to let you know that's happening, and I'll keep everybody posted on how things are going.
That's a great thing to share in round robin. Thanks, David. So Heidi Schallberg has put something in the chat I think that everybody can see, but I don't know, Heidi, if you want to, if you raise your hand, we can unmute you. Otherwise, I can summarize what you're saying here. I think it's an important milestone and something to look at how well we've done and learn how well we've done or what we still need to do and not done well for implementing ADA. So if I see Heidi's hand up, we can unmute. Otherwise, I'll read a little bit about what she's talking about there.
Can you hear me okay?
Oh, great. Thank you, Heidi.
Okay.
Yeah.
I think I clicked unmute. Yeah, just, we've played a role at the Met Council as the MPO with Federal Highway Initiative in Minnesota over the past few years, as far as ensuring that all local agencies in Minnesota have ADA transition plans or self-evaluations if they're not subject to the transition plan requirement. And I've seen some research that was done at UIC in Chicago, I think, with the ADA Resource Center there on evaluating quality and completeness of ADA transition plans nationally. And I think, just kind of as we're looking at our long range plan, we have goals about healthy and equitable communities and access to destinations, but we don't really have data or metrics tracking how we're doing on this issue. Like how are we doing in actually making our public rights of way accessible for people with disabilities? And, you know, we kind of in transportation tend to value and put a lot of effort into the things that we identify as metrics and that we measure. And how can we move this up in priority and get some data? So, you know, I would love to be able to have like a region-wide metric. You know, we're at 30% of our public rights of way meet ADA requirements. But we don't really even have that data kind of consistently. So anything that we could be doing research-wise to help build on some of the work that UIC has done, and you know, just recognizing the ADA is kind of the bare minimum threshold, right? It's not meeting full accessibility needs, but these timelines just kind of seem infinite, and we'll be working on our long-range plan for a 2050 time horizon. It would be nice to have a goal, you know, a really specific goal. We want an accessible region by this date, and we're going to track it.
So Heidi, do you see some of that also linking to some of Yingling's research and talking about the social exclusion? So if there's a way to measure social exclusion, that's part of measuring whether these ADA improvements have been successful, or is this, or is it more than that, or would that be a part of it?
I think that totally makes sense as a part of it, you know, because I think they're, you know, that framework too, where they're also excluded from power, right? And really having influence on these decisions. So
yeah, and when I
go ahead.
No, I'm sorry. Yeah, when I think about, you know, ADA as an example, you know, that's one marginalized group that, you know, has taken us a long time to, you know, start implementing, you know, or to get, you know, make progress in implementing, you know, point out 32 years ago was the passage, and took a while to get momentum, and we're starting to make some progress with that. So that's kind of an example of like how you look at you know, making improvements for a group. So what lessons learned can we have from what we did well in that stage, and what could we have done better, and how can we apply that to making transportation better for all marginalized groups, and listening to needs. So good to reflect on what we've accomplished with that, and how it applies to other things. So that could be a piece of research too. And then what those performance measures are that include social exclusion.
I will just quickly mention, you know, I very much appreciate this conversation around ADA, because that even the demand responsive transit that we provide for people with disabilities, there is actually a time window. Like, you know, you have to wait. I mean, the bus will, you know, the van, typically it's not a high capacity bus. The van will arrive between 9 and 11 a.m. And the person who ordered that demand responsive transit service will have to wait between 9 and 11, because it doesn't show, you know, it's not exactly, you know, telling you, you know, the bus will, you know, the van will arrive, you know, at 10:15. So I think it's just a lot of inconvenience that built into the, you know, in the system. Yes, they do have access to demand responsive transit, but is that service good, high quality mobility service? I think that's questionable. Also that similar to ADA, kind of the service we provide for people with disabilities, for elderly people, there is a form of transportation provided to them, which is called non-emergency medical transportation. So basically that if it's not medical related, you know, the elderly people will have access to that transportation service. I mean, it's also a door-to-door demand responsive transit. But then, you know, for elderly people, you know, not able to go visit a friend, that, I mean, although it's not, I mean, visiting a friend may not be medically related, but it's a health related, right? So I think, if we define health more broadly, not just simply say that, well, we will provide you transportation if it's medically related, but if you don't provide those essential services, eventually it will be medical related, right? So just thinking about how we actually can prevent, good transportation can save the cost we spend in the medical care sector if we provide, more inclusive, like a more health-oriented, more preventative type of transportation services to the elderly population.
Building on what, maybe phrasing this as a research question, I'm really curious if we have done research in coordinating with our indigenous populations. Our Native American tribes are providing some outstanding mobility as a service services that far exceed ADA requirements, that far exceed what is the standard of practice elsewhere in the United States. So I'm curious, I know that in terms of ADA that we have been coordinating with our Native American populations, and I'm curious from a research perspective, and this is something, again, we can bring back to our council and to our CTS colleagues to provide some information on if we have and how we have been coordinating with our indigenous populations to help meet population needs in geographically diverse areas and also culturally diverse areas.
Yeah, that's a good idea to learn from what others are doing, including, we look at we saw some examples of Western European in the social exclusion, but there may be some good examples right here in our area with indigenous populations. So that'll be a great research project. Well, I see Gloria's got her hand up, so I don't know if we can unmute Gloria.
Okay, I was going to suggest I'm finding this particular conversation fascinating. I always acknowledge that I'm an old person, and so you have to sort of put up with the fact that I'm an old person. A lot of this conversation feels like the conversation that was had back in the 1970s and 1980s around what was in those days called dial-a-ride service, where anybody who needed to get from point A to point B could call, and this was basically in small and medium-sized cities. Big cities like New York and LA and others didn't really adopt it, but cities the size of St. Paul and Minneapolis did. It was called dial-a-ride service, and it was open to anybody. And then they started prioritizing it so that the folks that we would describe as being on the margins became the priorities, and then the demand for health-related travel became so critical in terms of the needs to be addressed that they kept narrowing the priorities kept pushing down anything other than healthcare. And it might be interesting to do a history roadmap of the evolution from the dial-a-ride type services to where we are today, because it feels like we're reverse engineering how we got to where we are to back to where we started, which was a demand responsive system that met everybody's needs with respect to getting from point A to point B. And then as the needs of the population changed and particular groups became more dependent upon, the prioritization led to where we are today, which is health-related travel being the dominant one on these demand responsive systems. And it's sort of like, it should be looked at, where did we start and how did we get to where we are today, so that we don't repeat the history of what we used to do, but learn from what we used to do and how we got to where we are now.
Oh, Gloria, thank you so much for sharing that. If anybody that knows me, I love looking back at history and figure out, like, why did we do that and why did we stop doing that? And that's fascinating to hear that dial-a-ride started as a service for anyone. That would be really important to go back and look at that. And and another piece of looking back at history is like sometimes we're having the same conversations we did before, and did we make any progress? And that would be a really interesting research project to look back at that and learn from the past. Thank you. Anybody else have any thoughts on historical services and how that might be framed? No, I'll hook up with you later, Gloria, and try to learn a little bit more about that. That sounds very interesting. Others that are helping me monitor the chat, do we see anything else that we need to share? Or any other hands up?
And I think we, Lisa, continue to see, and I did save the chat so that we can come back and reflect on it. You know, again, more conversation about human-centered design and how that is, you know, complementary to logistics and freight and goods movement. So that's absolutely something we can continue to explore and to talk about as part of our council. Again, thank you to everybody today who has brought questions and topics to our discussion. Katie, any housekeeping things that we should be keeping in mind, our next meetings, or I see that is also in the chat.
Yeah, just a reminder that we do have upcoming meetings. It was mentioned earlier, but I did drop that in the chat, and we will be sharing the information on how to register. So again, the April 19th webinar on electrification of the freight system in Minnesota, barriers, opportunities, and a multi-criteria planning tool. So that's the 19th at 10 a.m. And then the 21st of April, a webinar on new tools for informed decisions in pavement. So more of an infrastructure related webinar, 2:30 p.m. And then finally, and these events are all free, the CTS All Councils meeting, which will be held on May 9th, both in person at the McNamara Center at the university and virtual. So whatever your comfort level is. And we will be sure to brief folks on, you know, all things public safety and public health related regarding COVID. And we'll be following guidelines and communicating that. That is 9:30 in the morning at McNamara. So stay posted for more information on that. But thank you everyone for joining today. And Mary and Lisa and all participants, great job.
Thank you. Yeah, well, as we're wrapping up here, if anyone's got any final comments, raise your hands. Otherwise, we can let you go. And thanks again.
All right, everybody. Thank you so much for an excellent council meeting today. Thank you so much, Yingling and Nissa, for participating and hosting an awesome conversation. And we look forward to seeing you, if not at one of these other CTS events, but at our fall meeting. So take care until then.
Thank you.
Thank you.